Vermilion Parish is nestled in southern Louisiana, just a few miles from the Gulf of Mexico. It's a place where people work as hard as they play. Outdoor enthusiasts from across America travel here for hunting as well as saltwater fishing along the coast and freshwater fishing in the Vermilion River. The largest parish in Louisiana, Vermilion spans over 1,200 square miles of rich farmland, cattle ranches, and wetlands. Residents find all the amenities of a large city without the urban problems like traffic, congestion, and crime. The healthcare needs of Vermilion Parish are met by professionals who provide outstanding clinical care and deliver it in a very personal, family atmosphere that is the hallmark of rural healthcare. There are 3 hospital service districts comprised of 2 accredited hospitals, a nursing home, clinics, and a wide variety of physician specialties. Abrom Kaplan Memorial Hospital could easily be called the People's Hospital. In the late 1950s, residents in the Kaplan community realized it was time to build a facility that could meet the healthcare needs of the area. Many people wince at the prospect of new taxes, but voters knew this crucial project would need funding for construction and eventually to operate. So they passed an initiative that led to the opening of a small hospital that has continued to grow for over 40 years.
To give you a little history of the hospital is a Hebert hospital. The community of Kaplan decided that they wanted to have a community hospital, so they taxed themselves for, and then they eventually passed a bond issue for dollars to be able to build a hospital, and it was built in 1958, 59, opened in 1960. And today we are licensed for 50 beds. But we have a 10-bed rehab unit, an 18-bed psych unit, and the rest of the beds are acute care beds for our patients here in the community. The rehab unit is what we call a hospital within a hospital. And the services that they do there, they rehabilitate the stroke patients or patients who have had orthopedic surgery. Being a small rural hospital, we have people from Lafayette Journal that if we need a special, say for example, if we need something in the business office or medical records, and we need an expert to help us guide us through some dilemma that we have, then we sort of tap their resources and they send their personnel over and help us out to get our problem solved. It has been a very good working relationship, and the community is very, very pleased, and so is the staff and myself.
When confronted with life-threatening events, we're here for you. At Abrom Kaplan Memorial Hospital, our 24-hour physician-staffed emergency room team is there when seconds count. People depend on us not only when life hangs in the balance, but also for many non-emergency medical needs.
And when you enter the emergency room, we have quite a large emergency room physical space in the ER proper. So it's very personal. You know, you have your privacy that's maintained. 6 rooms, 1 large trauma room, or cardiac room as we call it. If we have critical patients, we're able to move around in this room and get a number of staff in here without any problems. And pretty much we have 2 rooms that are set up similarly, the medical treatment rooms. There's 2 of them, and then there's 1 that we use for orthopedic supplies, and then another one for female patients. So we're essentially the outpatient service department as well as the emergency room. I think that we go above and beyond because of our Cajun culture and the way we were raised. You know, we love people, we love to know people, we like to know where they came from, and we like to help them. We like for them to remember us for our hospitality.
At Abrom Kaplan Memorial Hospital, our lab conducts an array of diagnostic tests, including chemistry, hematology, and microbiology. We work closely with our physicians to diagnose disease and are committed to keeping Kaplan healthy. We offer a variety of free community health screenings that include cholesterol, PSA for prostate cancer, and diabetes.
And we do this free of charge for the community. Either we do it at City Hall, or one year we'll do it at City Hall, the next year we'll do it here at the hospital, next year we'll do it at one of the banks, and we try to go around the community. A lot of times we find that, especially with the eating habits that we have in Southwest Louisiana, the majority of those people do have high cholesterols, and eventually they see their physician, and hopefully that we prevented heart attacks.
Dedicated, caring nurses are at the core of the healing process. Our nursing team provides clinical care in a very personal manner.
There's a warm, friendly atmosphere, and it's just a comfortable place to be. They're hardworking, dedicated nurses. They've committed to this hospital. A lot of them have been here for many, many years. It's a great place for new nurses because as young nurses they can learn a lot. Louisiana Technical College, the Gulf area campus, uses our hospital as a teaching facility. It's a great learning experience here because we have a variety of patients. We take care of pediatrics and geriatrics. We do med-surg, so they get a variety of experiences. They come to us sometimes without family members, so we become their family. We do their grooming, we sit with them, we sometimes read things to them at night. I've even had nurses go in and pray with the patients because there is no family. We have a lot of patients who keep coming here because they like the smaller hospital and the friendly atmosphere, and they like to be taken care of by people they know. They feel secure here.
We provide the Kaplan area with an array of complex diagnostic technology like CT scan, ultrasound, nuclear medicine, and mammography.
A lot of people don't realize that we do CT here, and then now that we have this kind of equipment that's better than some of the other facilities, we're proud of this. It's fast. We're small, but we have technology that a lot of people don't think that we do have. We offer ultrasound, CT, mammography, fluoroscopy, and plain x-ray. We also offer nuclear medicine. We do a mammo special during October, which is National Breast Cancer Awareness Month, and we offer mammograms at a reduced rate for our patients here. Those months we do anywhere from 80 to 100 patients at a reduced rate for those that don't have insurance or can't afford, so we can get those people in here to help prevent that. So a lot of facilities don't do it anymore, but we still continue to.
An important capability is teleradiography, which allows physicians to view diagnostic images even if they're not in the hospital or the office. This results in faster diagnosis and expedites the beginning of necessary treatment.
Well, telerad is exactly what it entails. It's teleradiography. Telerad gives us the capabilities for the radiologist to access information from anywhere he's at, any location, whether it's his house, the hospital, on vacation in Florida, wherever he's at, he can have access to that kind of information if need be. We have access to our radiologist. If somebody comes in right now, within 10 minutes, I can have it to the radiologist in Opelousas. A lot of patients appreciate that.
Our surgery team is one of the most experienced in Acadiana. Team is the key word here. It's second nature for our tight-knit surgical staff to move in sync with the surgeon and each other to provide an outstanding level of care.
We have two rooms. We have a general surgeon, Dr. Malman, and we have a GYN physician, Dr. Amara, and they do surgeries here. We also do orthopedic surgery. We do GYN surgery, general surgery, and orthopedic surgery with Dr. Budden.
We have the capability to do some of the new, like the laparoscopic procedures. On an average, we can run anywhere from 20 to maybe 30 cases a month. But that's about our average. We do have a small crew. We have 2 on-call crews, but we work as a team. We all do the same thing. We're all here for the patient.
Excellent surgical care, excellent anesthesia care, very, excellent nursing care.
We do pride ourselves in being good caregivers.
We're a small group, and I think that makes a big difference. You don't get lost in this huge department. We're a small department. We know each other, Yeah, it's like family.
If you're happy on the job, then your patient can pick that up. And it feels good when they come back and then they'll tell us, there's no surgical team like your team. We may do 20 or 30 cases a month, but we're all on those 20 or 30 cases a month.
We provide all types of anesthesia. I mean, anything that you can think of, from epidurals to nerve blocks to different things. We do all types of anesthesia. You know, where some places don't have that capability.
While you're here, you are part of our family. I've trained at other facilities. I've had family members that have been sick and have been in the bigger hospitals, but there's nothing better than being in a small town community hospital.
I'm KK Herpin. I'm from Kaplan. My experience was with my youngest son, who was 27 at that time. Brant woke up one morning, stood up by the side of his bed, and fell down completely out. And his wife's name is Mindy. She called 911, and the rule is that you have to bring them to the closest hospital.
It was a little early in the morning. I saw Miss KK walking into the emergency room. And it hit me that it was probably, you know, Brant.
As I was walking in, the head nurse here, Kitty, saw me. They went ahead and worked on Brant.
We had a multitude of staff in here trying to help him. How could we get his heart beating again?
At this point, it was a handheld compression tube down into his throat.
And whenever he was not having a pulse, we would press on his chest to have artificial circulation. He was attempting to somewhat breathe. And it was like, oh no. And when his pulse went away again, and like a light switch again was flicked on, he regained a pulse and a pressure. He had a wonderful chance.
When you live in a town as small as Kaplan, it's family.
It's obvious, you know, that he's made a complete, full recovery with no deficits, no problems with any of his activities of daily life. I think he had a strong will, obviously.
The doctors here and the team here saved his life.
Well, most of our patients here are from Kaplan, and a lot of the employees that are here are from Kaplan. Some of them aren't, but the majority of them are. And they've been here 20, 25, 30, 40 years. And that tells me that the community and the people that work here want to stay here and want to help out our community. I find that's one of the good points that as an administrator that I have, because the people that are here want to be here. They're not, you know, they're here and they want to help, because it is their community and it is their hospital.